what is nicotine's drug action? Well, nicotine acts at what we call cholinergic receptors, right? Remember, cholinergic receptors are receptors that respond, typically to the release of acetylcholine or the binding of acetylcholine. There are nicotinic receptors. These are acetylcholine receptors, cholinergic receptors, that are selectively responsive, right, to nicotine. They are ionotropic, okay? That means the receptor, when it binds nicotine, will shift its shape and open a channel that will allow some ion to pass through. And the ions that pass through are depolarizing ions. They're going to move the postsynaptic cell towards threshold for an action potential. They're going to excite or stimulate the next cell. They tend to permit the entry of sodium ions, right? Sort of a classic depolarizing ion, and sometimes calcium ions as well. Now, one thing to know about nicotinic cholinergic receptors is that postsynaptically, if they get overstimulated, right, they tend to shift into a position where they no longer respond, to acetylcholine or to the nicotine either. So they desensitize. So it turns out that when you're smoking a cigarette, after a while, it's no longer going to have a site of drug action. The receptor that it typically responds to, and allows for to depolarize, is going to shift into this form where it's not going to be responding to the nicotine anymore. Okay? One other interesting aspect of where nicotine acts is that some of these nicotinic receptors are actually located on the presynaptic cell. So they're actually located on the axon terminal at a synapse that releases the acetylcholine, or that releases dopamine, or that releases norepinephrine, or that releases, serotonin. So all of these, axon terminals that are going to release all of these monoamines, right, and acetylcholine, by nicotine action on these presynaptic terminals, nicotine promotes the release of dopamine and promotes the release of norepinephrine and promotes the release of serotonin. So nicotine actually circulating in the central nervous system will actually promote the release of many different neurotransmitters in the brain, including, of course, dopamine, which is linked to dependence and abuse. In the peripheral nervous system, nicotine acts at cholinergic receptors in both the sympathetic and the parasympathetic nervous system. Just know that it has pretty extensive autonomic effects as well, including increased blood pressure, heart rate, and adrenaline and norepinephrine release. This is actually sort of an arousing kind of response that may contribute to nicotine's reinforcing effects as well. And there's also parasympathetic activation, and sometimes there's release of additional stomach acid with this kind of stimulation in the peripheral nervous system. PNS effects can actually lead to some toxic, ultimately fatal effects of nicotine. There can be, heart attacks, stroke risk, cardiac issues, with continued use of this drug.